Why do so many Americans suffer from depression? Depression has become a major mental health problem in the United States, affecting more than 21 million adults each year. This condition not only reduces quality of life, but also impacts work productivity, social relationships, and even suicide rates. To understand why so many Americans suffer from depression, we need to look at the root of the problem from various social, economic, cultural, and biological perspectives. 1. Modern lifestyle pressures. The American work culture is known for being highly competitive. Many workers face demands to be continuously productive with long working hours, little downtime, and job insecurity. The phenomenon of hustle culture also triggers chronic fatigue and prolonged stress, which are the gateway to mental disorders such as depression and anxiety. 2. Loneliness and social isolation. Although America is a developed country with access to high technology, many of its citizens feel lonely. Individualistic lifestyles and a lack of community or social support leave many people feeling isolated. Research shows that chronic loneliness can be as harmful to physical and mental health as smoking 15 cigarettes a day. 3. Economic inequality and cost of living. Widening economic inequality and the high cost of living contribute to psychological burdens. Many Americans are trapped in student debt, high housing costs, and lack access to adequate health care. This feeling of financial insecurity leads to chronic stress, which leads to symptoms of depression. 4. The influence of social media. Social media has its benefits, but also its dark side. Exposure to content that triggers social comparison, cyberbullying, and the pressure to be perfect, especially among teenagers, has been linked to increased rates of depression. Studies have found that excessive social media use is correlated with increased symptoms of depression, especially in young users. 5. Lack of access to mental health care. While America has sophisticated mental health facilities, access is uneven. Therapy and medication are often expensive and not fully covered by insurance. Remote areas, the number of professionals is also limited. As a result, many people with depression do not receive adequate treatment. 6. Genetic and biological factors. Depression can also be influenced by biological and genetic factors. Neurotransmitter imbalances in the brain, a family history of mental illness, or traumatic childhood experiences can increase the risk of depression. While these factors cannot be avoided, they can be exacerbated by social and environmental stressors. Addressing the rise in depression requires a comprehensive, cross-sectoral solution. Here are some effective approaches that can be applied at both the individual and system levels. 1. Increase access to mental health services. Mental health subsidies and insurance should be expanded to make therapy and treatment accessible to all, especially low-income communities. Telehealth, online therapy, also needs to be further developed to reach remote areas and those who are reluctant to meet with a therapist in person. 2. Education and stigma reduction. Public campaigns that emphasize that depression is a treatable medical condition, not a personal weakness. Schools, workplaces, and social media can provide educational tools to recognize the signs of depression early and encourage help-seeking. Theories build community and social connection. Social support is key to recovery. Community-based mental health support programs or peer support groups can be very helpful. Local governments and organizations can encourage social activities that connect people, reduce isolation, and build a sense of belonging. Rewinds in work and education culture. Encourage work-life balance, work flexibility, and mental health leave. In schools and colleges, the importance of student mental health should be made a priority, with trained counselors and stress management training available. Early intervention and prevention. Routine depression screening at primary health care facilities can detect early symptoms before they become severe. Early emotional education in schools can help children manage stress and build mental resilience. 6. Encourage healthy lifestyles. Physical activity, adequate sleep, healthy eating, and meditation have been shown to help reduce the risk of depression. Community programs that support healthy lifestyles, such as yoga classes, public playgrounds, and access to healthy foods, are essential.